The Kenya Medical Practitioners, Pharmacists and Dentists Union KMPDU has called upon the government to streamline the public healthcare system in the country. The union, led by Secretary General Devji Bemji Atela, singled out the recent case of the young boy who lost his life at Kenyatta National Hospital on Tuesday after having a fork jembe lodged in his skull for almost 2 days, saying that the situation was preventable.
This kind of deaths are a reminder for every Kenyan that none of us is safe until the public healthcare system in Kenya guarantees the highest attainable standards of emergency care to the humbles amongst us. And this is enshrined in the Constitution, Article 43.
Citing a similar case of one of their own, Stephen Mogusu, who died after contracting COVID-19 in 2020 from a ward he was working in and was not attended to on time, leading to his demise.
Many other preventable deaths have occurred in our health facilities, and mainly as a result of weakness in our healthcare system. For instance, lack of ICU facilities, absence of appropriate health products such as oxygen or blood, and also lack of the right mix of skilled personnel.
They also have called for an end to commercializing of healthcare services, which has increased inequality and isolation amongst the poor who cannot afford to pay. This comes after Judy Muthoni, the deceased boy's mother, who claimed that the hospital management asked the family to pay 20,500 shillings, which they could not raise, where the boy died waiting to be taken to the theatre.
The child had already bled too much, and once you bleed in a topic called trauma, that is in surgery, I'm a general surgeon by profession, is that your coagulation or blood clotting system becomes compromised. And hence, any attempt at cutting you or doing surgery on you will actually, yes, kill you. That is what you call taking the patient away from the disease, not the disease away from the patient. So if any early attempts had been made, based on the reports that we had and based on the science that we know, it will be more detrimental to the child than it will be helpful.
Ideally, a level 5 needs to be able to have all the requisite personnel, that is the neurosurgeon, the anesthesiologist, and all other consultants, and an intensive care unit that should be able to handle emergency cases. But at the backdrop of this issue, we saw that this boy was transferred, meaning that the level 5 hospital in Thika and other level 5 hospitals in the country cannot handle emergency cases.
The union also decried the lack of skilled personnel in health sector and called upon national and county government to upscale the employment of specialized healthcare officers in hospitals.
We have an actual dysfunctional public healthcare system in both the counties, and I will say also the national, to the extent that we have level 4 hospitals, level 5 and level 6 that do not live to the basis of the accreditation. We want to make healthcare affordable. The healthcare should be accessed by every Kenyan in every place, regardless of funds or regardless of socioeconomic status. That's why we are calling the government to really invest in healthcare that can ensure that Kenyans have an access to medical emergencies in any part of the country where they are.
After the death of a baby with a jembe forked into his head made rounds on social media, medical practitioners KMPDU have come calling on the national government and health stakeholders to put in place the right infrastructure to ensure such incidences do not occur. Stanley Lugaria, The Informer, uncovering the truth.